Good morning. I will call this meeting to order. It's February 15th, 7:00 a.m. This is Independent School District 832, the Mahtomedi Public School District, a special meeting. We have a roll call of attendance.
Aldana,
Here. Good morning.
Kevin Donovan,
Here.
Julie McGraw. Here. Lucy Payne. Regan, Stacy Stout.
Here. We have the approval of a motion to approve the agenda. Moved by Kelly, seconded by Kevin. All those in favor, please say aye.
Aye. I would just also like to note that Tolu is here.
Yes, I think that should be recognized. I think that's admirable. So thank you for being here. Okay, all those in favor say aye.
Aye.
Opposed? Motion passes. Discussion of information items.
With me, thank you. So thanks for being here early in the morning, everyone. One of the questions I received was about why are we having this meeting at 7 a.m. And I would want the public to know we're meeting at this time because it is very difficult to get all the board members in the room at the same time due to their busy schedules, unless it's a scheduled board meeting. So this was the first time that we could find for everyone to be together. And so why are we here? We're here. I'm going to be sharing updates, health and safety updates with you. I've done this on a regular basis throughout the pandemic. And so this is normal in that regard. You had set goals to keep our students safe and learning in person at the beginning of the year and to use objective information from our health experts. And so that's what you did at the beginning of the year. That's what you voted on when we voted on the resolution at the beginning of the year. You voted for the opening, how we were going to open our school in terms of health and safety protocols. But throughout the pandemic, as things have changed, we've changed with those, with the new what we've learned, and also with the rates of our COVID case rates as we've gone through it. So we're at a point where we're going to be making a change again. Our team is in charge of the implementation of your goals in terms of the health and safety. And so we have been doing that all along, and we have a timeline for some other changes that we're about to make. So we're going to share those with you. And so with that, I think I am able to drive this, but if not, oops, nope, I'm not going to touch thing until I'm going to pull this up. Here we go. Thank you. Thank you, Patrick. I think I can, I'll try. Can I take it from here? All right, here I go. So what I'm going to go through with you, first are really our priorities and accomplishments for this year. Public health information that I share with you on a regular basis. I will share that with you in terms of where we are. And then I'm going to share changes to our mitigation practices and a timeline for those. And then our continued health and safety protocols. Oops. There we go. So I want, So I want to remind you that at this point we've kept all of our students full-time in-person instruction, and we have not transitioned any classroom grades, cohorts, or schools to distance learning. I'm going to go off of my screen instead, so I'm not looking over my shoulder. So throughout the school year, you know that I've been consulting with you and local public health experts about the COVID-19 situation. I've provided you updates. I want you to also know our students experience consistent quality instruction through and programming. There are times, I know you've heard of districts that have had to pull everyone from the district office, or people were teaching in areas that were not their expertise necessarily out of necessity because of the situation we were in. We did not have that at that same degree. Our leadership team has we continually review those public health information and recommendations and establish our health and safety protocols. And so as an example of a change that we made this year is when we did change at the beginning of January and reduced our quarantine and isolation practices based on new information. So whereas previously students all needed to quarantine for at least 10 days, we were able to change that and shorten those quarantines. that is in large part, I do want to acknowledge the work of our staff throughout all of this to make these changes work and operationalize them, because one of the things we were able to do is have staff members who support students as they went in and out of quarantine and help them with that transition. So that's something we've been able to do as well. And we have free COVID-19 testing for staff and students. We send it home with students, and we also have a testing site that we partnered with White Bear Lake, and we're thankful for their partnership as well, because that has helped us immensely with our testing options for kids and families. So back in December, we shared this information regarding the public health information that informs our mitigation removal. And we've shared this other times as well during the school year. Washington County transmission levels that are approaching moderate and have 3 weeks of trending downward data, low building case rates, and high vaccination rates. These are the key things that our public health officials have shared with us that are important for talking about shifting mitigation measures. Oops. Okay, so here's what our Washington County data shows. It shows a significant downward trend. And you'll notice if you look down below at the dates, if you look at January 31st, it was still up pretty high, but you can see that rapid decrease that we've been experiencing. So I know, I'll just say, I know I've heard from people who would like us to move more quickly. I would want you to know that just a couple weeks ago, we were at a really high level, and our practice is really to continue to watch that data and to make sure that we're keeping kids safe and learning in person, because that's our objective. This is also what our school level at the district, from a district wide, this is what our case rates look like, and you can see that they are down significantly at this time. I also want to remind you I've talked to you about this before, since last year, actually, when we were in, I think it was in January, we were experiencing, again, a really rapid decrease in cases, and we were comparing what does this number mean on the downward trend versus that same number on an upward trend. So I've also heard from people who have asked about the rates that we're at right now compared to how it's similar to something that we saw earlier. And once you know, the difference is the trend, because the trend does matter in terms of how it affects our operations, our staffing, and our student rates. So right now we're seeing a rapid decrease, and our numbers that we can expect to continue to decrease. And so that is a difference between now and November. Oops, did I go too far? Nope. Okay, sorry, I'm trying to do this both on my screen and on your screen here. These are our vaccination rates for students and staff. Students, on our dashboard, we have just the student rate. This is students and staff together. In part, we wanted to show you this because as a different way of considering the whole community. So when you think of our school community, we're using these numbers just to include our staff in here as well as part of that community. So that's the slightly different than what you see on the dashboard. So this is our timeline. And again, I'm going to say this one more time because I think it bears repeating that our priority throughout this pandemic, it continues to be keeping our students safe and learning in person. So we are seeing the variant receding. We're seeing that decline in cases. We have that availability of vaccines. We have there, and I did call Washington County. There are quite a few appointments. And so at this point, Mahtomedi Public Schools is going to begin removing some of these mitigation layers. So starting today, face coverings will be recommended but not required for after school and evening programming in all school buildings. The exceptions, face coverings are going to be required during school conferences, if you are going to a face-to-face school conference, and also Mahtomedi Adventure Club, our after-school student programming. Starting next week, February 22nd is a Tuesday because we have a long weekend. Elementary students will begin to have recess and lunch with peers outside the homeroom class. I would want you to know, so for those of you who are not in elementary schools, changing established expectations and routines with younger students does take time and explicit instruction. So there are a number of routines that our staff need to take our students through as they change mitigation strategies. And so I did have a question about why do we have different timelines for our secondary and our elementary? And I want you to know that this is at recommendation of our principals who have said we have things we really need to be able to teach our students. One of them is the routines, and that's a significant part of elementary. Another part is we are going to have students who are making different choices based on their family's choices, and our staff needs some time, actually at all levels, to be able to work with our students on how to be able to be respectful of differing perspectives and take those differing perspectives. So our elementary administrators have requested some additional time to roll those practices forward and to work with their students to be able to establish those new routines and have those conversations. So February 22nd, again, recess and lunch out with peers outside of their homeroom class. To this point, they've been eating in the classroom and only having recess with their peers from their classroom. Preschool parents who are wearing masks will begin entering classrooms for pickup and drop off. Our preschool teachers have said that having our parents be able to be in the classroom, it would be a nice thing for them to be able to see, be able to interact a little bit more. So with a mask, they can begin entering our classrooms for pickup and drop off. Face coverings will be recommended but not required at all our secondary schools. That's for students and staff at the middle school, high school, and Passages transition program. Also here for community ed and the district office, as long as there are no preschool students around, that masks will be recommended but not required. We do have preschool programming in here, so if anyone is coming to our offices or for community ed, I would ask that you remember to bring a mask along, because when preschool students are present, we will be wearing masks around them. February 28th, face coverings will be recommended. That's the following week then. Recommended but not required at all our elementary schools, and also for our students, E21. However, face coverings will be required for all staff and adults who are around our preschool students. That will continue. So one more time, we are going to have some face covering requirements. That is going to continue. Preschool around our students, our preschool and early childhood students, all adults are going to be wearing masks around our preschool students. School transportation will still be required for face coverings. And then we will also have, if someone comes back before the 10-day quarantine, you remember we shifted to a 5-day quarantine option for students, and that still stays in place, that between days 5 and 10, students who have returned from quarantine will need to wear a face covering. And we now do have a nice supply of KN95 masks for students who need them. So I see I haven't been flipping up here is what you're telling me. Thank you. So that will be the case. If a student cannot wear a face covering and has been out in quarantine, they will need to stay in quarantine. Between days 5 and 10, they will need to wear a mask. So in terms of our health and safety protocols, I want you to know we're going to continue to ask families and staff to report positive COVID-19 cases and report those numbers by building. And we will report those numbers by building in our dashboard each Friday. We will continue to notify families of COVID-19 positive cases in all elementary classrooms. One updated practice, our COVID-19 case notices for secondary will still happen if there are 3 or more reported cases in a classroom. So that will continue with notifications. I'm sorry, it won't continue. It'll be an update to our notifications. We ask that families continue to monitor for illness and stay home when sick. We're going to continue to follow our quarantine guidelines and then also the 5 to 10 day mask requirements. We're going to make our decisions on a case-by-case basis. We have been doing that in terms of looking at whether or not we need to quarantine classrooms. We're still going to continue that. We will still continue to offer free at-home testing and our free testing site in collaboration with White Bear. I'll just repeat that according to public health experts, vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. So we will be sharing information about how to access vaccine. And we will continue to communicate with families about the pandemic, any surges in cases, and the need for additional mitigation layers. And with that, that's all I had to share with you. Do you have any questions for me?
Barb, thank you for that presentation. I think as I've shared in all of our conversations about masks, the priority has been to keep our students learning in person. We've remained committed to that, and we've had in-person learning all year. As you pointed out, that didn't happen everywhere. And I know when we discussed this in August, we did commit to a regular review of our community and our building data. And that has been consistent. And I think it's been a hard journey for everyone, for teachers and students and parents. And I'm so happy that we are turning the corner and we've seen the downward trend, and we can take the step to remove these measures. So
I think everyone is excited to be able to see this,
Yes.
this downward trend. And I'm just going to reiterate what our what our teachers are going to be doing with students, and really working through the different perspectives and understanding the different perspectives that each student is going to be coming with, each student's life experience, everybody's needs when they think about their families and their and extended families. And I do know that I trust our teachers to really be able to help our students, help us show the way in terms of how we can work together to honor differences, honor different perspectives, and continue forward. So. Mhm.
Comment. Thanks, Barb, for all of that information. I know that our community's been waiting to hear a lot of this news, and also now this probably brings some new anxiety for some families that now there's a change. I guess some of the things I took away from that are some changes to reiterate that the email process will change. I know I have kids in secondary, and so if there's 3 or more cases is when we're going to get emails. Is that
That's correct.
the change? And then secondly, the message I heard loud and clear is still, again, stay home if you're sick. So we don't have to come back here and have a conversation possibly if things turn the corner and go the wrong direction again. So that masking is required for the 5 to 10 day so that we don't have to avoid longer quarantines. So after 5 days, students can return back to school.
That's correct.
Thanks, Barb.
Mhm. The one thing I'll just offer is that we will continue to have these conversations regardless. I'll continue to give you updates so that you know the status. Mhm.
I can't see Paul, so I don't know if he's trying to speak.
I do. Can you hear me okay?
Yes.
Okay. Barb, thanks for your diligence throughout this process, to you and your team. Could you, I think it bears importance to underscore the recommendation regarding the lag in timing between the upper and the lower schools. Could you just repeat that? As much as, certainly I'd love to see us all come off, at the same time. Could you just repeat the rationale behind that recommendation?
You bet. So again, with younger students, changing expectations and routines takes training and takes a little bit of extra time. There are some things that, well, actually, I'll just say in any level, anytime you change routines, it takes some training. But in particular, for elementary students, there is training and learning that needs to go with change in practices and routines. And so the 2 things that are happening, one, our students are going to be going into the lunchroom and going to be at recess into the lunchroom, still in cohorts, but out at recess, they get to play with whoever, they don't have to stay in their cohort. And those changes will require some additional explicit instruction and training. So that's one thing our teachers are going to work on. The other part is just being able to recognize that students are going to be making different choices, and families have different choices for their children. And so we want to be able to have some time to have conversations about how to respect, or have respectful conversations, understand differing perspectives. And so our teachers are going to be working on that with students. And so they just want some extra time, and this is at the recommendation of our elementary principals.
Okay, and then if I could, just a follow-up, a clarification on if there's exposure at school, students are not sent home, correct?
No, we haven't, no, they're not sent home. We haven't been doing that all year. So this is, we will still continue our notification. I'll just say, with this, the change in mitigation strategies, we are still going to be working on maintaining our physical distance. So we haven't let go of that. And that's still a significant part of what we do. And so we do still have classrooms that are set up with that physical distance. So, no, we won't be sending students. And frankly, we do not have the capacity to do extensive contact tracing, which is another part of this that we did at the beginning of the pandemic. Was we did a lot of contact tracing. We just don't have the staff to continue that process. And so that's something else I would offer that you should know.
Okay, well, thank you. Thank you very much.
Mhm.
Comment.
Yes.
I just wanted to emphasize thanking our staff and Barb and your team for all of the work you've done on this, and just make sure our staff knows how much we appreciate everything they do for our students.
I have a motion to adjourn.
So moved.
By Julie, seconded by Lucy. All those in favor say aye.
Aye.
Hi.
Are adjourned.